So yeah, thanks so much for coming. My name is Jeremy Hudson. This is Zach Deneen with PT's, the Spine and Sports Injury Center in Boston. We're here to talk to you about track and field injury prevention. What we did was basically go through any research that we could find that published anything about the most frequent track and field injuries, their risk factors, modifiable or not, preventative measures, and what we're trying to do here is give you all the information we can and then show you some reproducible techniques that you can try on your own. We'll have some videos for you that will show you, for examples. All the videos will be available. We'll make them available either online or a Dropbox account or via email or something like that. And these are basically guidelines. You can use your own creativity and experience to modify them. It's just a basic principle of the moves that we're trying to implement to reduce the chance of injury. Common track and field injuries. There's the acute onset, meaning it just happened. Your strains, your sprains, your fractures, bad falls, etc. Trauma. Most common acute onset listed was thigh strain, hamstring, and groin. Another common thigh strain region would be the rectus femoris, so the front of the thigh, or the quad, lower leg, muscle strain, obviously the calf there and the lower leg, anything below the knee, and then the lateral ankle sprain, which we'll get into in a second. The acute onset injuries were most common in the sprinters and hurdlers. The risk factors they listed for the thigh strain really were only age, being you lose flexibility as you age, and eccentric strength, or weakness of eccentric strength, which we'll get into, and flexibility. Gradual onset, knee pain. Most commonly reported is pain in the front of the knee, anterior knee pain. Some of the buzzwords you hear clinically would be chondromalacia, patellofemoral syndrome, runner's knee, jumper's knee, patella tendon, IT band, Osgood-Schlatters. Osgood-Schlatters is most common in the young athlete. Ankle foot, Achilles tendonitis and plantar fasciitis, also commonly heard tibialis tendonitis, anterior tibialis and posterior tibialis tendonitis. Tibial stress injury, shin splints, just an umbrella term for pain in the shin. That includes stress fracture, tendonitis, or compartment syndromes. These are most common in the middle and long distance runners. Further gradual onset injuries, back pain. Back pain was not actually listed as one of the more common track and field complaints. However, it is the most common injury referred to practitioners across the country, according to CDC. So we included a lot of information on back pain. Things you might hear when you associate back pain: discs, muscle strain, facet, posture, a lot of scary things that are not very helpful to hear. Shoulder pain, obviously most common in the throwing athlete or the overhead athlete. Impingement, rotator cuff, AC separation, a lot of things you would associate with shoulder pain. General prevention, rest and recovery. Rest, common sense. Recovery, including nutrition, sleep, hydration, all things to allow the body to restore after a taxing event. Gradually increasing your intensity, frequency, and duration. The research on stress fractures and shin splints and other low injury pain syndromes talked about a no greater than 10% increase in mileage for runners. That's across sessions. Varying your training. From a standpoint of a clinical standpoint, doing the same thing over and over again makes you more prone for overuse injuries. Early detection, signs and symptoms, risk factors, some of the things we'll be listing. Also just getting the young athlete to admit that there's something wrong. Pre-participation physical, just about every state requires that you have one. Carefully going over the data from this can actually help to reduce up to 75% of injuries. And family history and past symptoms, just very important for preventing lethal conditions, none of which you'd end up seeing someone like me for. So now moving on now to muscle strain, most commonly thigh strain. That was the #1 listed reported time loss injury for track and field athletes. How do you prevent them? Warming up was listed as very important. There's 3 different types of warm-ups that they went through: passive, active, and sports specific. Passive is just simply using an external heating source to raise your body temperature to increase the flexibility. Active, voluntary movement. Simple. Sports specific is movement pertaining to competition or the sport. Research showed that the combination of the sports specific and active warm-up was most effective in increasing eccentric strength, which we'll get into, which is an important modifiable aspect of preventing the injury. Flexibility and vertical jump were increased as well, indicating that there was probably a performance-enhancing effect associated with sport-specific warm-up. Eccentric strengthening. This is a big one. A lot of support for this type of strengthening to prevent muscle strains and treat past muscle strains. Muscle contraction to control lengthening. That's what an eccentric contraction is. You're landing from a jump. These are the muscles that are controlling your descent towards the ground. They absorb impact, they absorb shock, and they contract at a time when they're most vulnerable to injury. And stretching, there's conflicting research on stretching. Most of the conflict is do you do it before, do you do it after? And simply, most of the most recent stuff is leaning towards doing it after a warm-up. And so if we're going towards some of the eccentric strengthening videos here, I'm just going to show you some examples of an eccentric hamstring contraction. So if you look here, we're getting a lift using primarily hamstrings, lowering with the leg to be exercised only. You can see that the athlete is lifting his buttocks up and lowering with the effective leg. Take a look again, lifting both legs, lowering with the effective leg. So the effective gravity is greatest on the effective leg. Next we have another version, slightly more advanced, where we're actually getting a knee flexion involved here, lifting the butt, bending the knee, and you can see just lowering the body down with the effective leg, eccentrically contracting the hamstring muscle. And again, the greatest load is on the leg to be exercised on the descent back towards the ground. Now, if you want to add resistance, with a lot of these athletes, it would be necessary, as body weight just wouldn't challenge a lot of the stronger athletes. So we have a weighted ball placed over the belt line, and you're simply lifting both legs, lowering with the affected leg, lowering with the leg to be exercised. And then again, it's putting the greatest amount of stress on the eccentric contracting muscle. Here's another example with the knee flexion, just bending the knees, holding the weighted ball over the belt buckle and lowering down slowly. Lifting, lowering with the affected leg back to the ground. And resistance is variable depending on the strength of the athlete, the opinion of the coach, pain, etc. So for the rectus femoris or quad, here we have a way that we have a weight around the ankle. You're lifting the knee close to the body and extending it so that gravity has its greatest effect on the descent, lowering the weighted ankle towards the ground so that it hangs off the edge of the pec. That is an eccentric contraction of the quad, specifically the rectus femoris. Move on here to the adductors or the groin, another commonly strained hip muscle or thigh muscle. You notice that we're having the model lift, extend, and lower out to the side with the knee fully extended, gravity having its greatest effect on the lowering aspect of the leg, the eccentric contraction of the adductors or the groin. Along here we have a much more advanced version of the adductor eccentric contraction. Never do this with somebody actually just sustained an adductor strain. It's more preventative. Notice the lift with both legs and the lowering down with the affected leg. The leg to be exercised is controlling the descent of the body weight back to the floor. You find this quite difficult to actually lower yourself under control to the floor. A failure could occur where they actually just drop, and that would indicate that they're simply not strong enough for the exercise. Moving on to ankle sprains. Ankle sprains. Lateral inversion ankle sprain, most common. Simply rolling your ankle, which most people understand exactly what that means, rolling at the outside of your ankle, spraining your ankle. Most common ankle sprain, 70 to 90% depending on what you read. Risk factors that we can modify. Ankle dorsiflexion weakness, toe landing, and ankle everter weakness. Ankle dorsiflexion weaknesses, those are simply muscles that control the roll of the ankle when you go into an ankle sprain position. Same with the everter weakness. The everters control the inversion associated with an inversion ankle sprain. Also toe landing. Landing on your toe puts the ankle in something called a loose pack position where it would be most likely to come out of joint. the toe landing is an argument, or a component of the argument against running on your toes. But we're not going to get, that would be a whole other presentation. So, non-modifiable risk factors include high BMI and previous ankle sprain. Previous ankle sprain increased the propensity for another ankle sprain by 19 times. So if someone has a history of ankle sprains, these types of things would be something you really want to take a look at with an athlete that has had a previous ankle sprain. So we can move on. So we have a few videos of just examples of movements that would help to prevent ankle sprains. Coming up here, we have the eccentric ankle dorsiflexors. You'll notice you're going up onto your heel using both legs, lowering the body weight down the slope, using only the leg to be exercised. So you'll close up there, lowering the body weight down the slope. The leg to be exercised is the one doing the descending down the slope. Here we have an eccentric contraction of the ankle everters. Again, the ankles that decelerate the inversion ankle sprain motion. Rolling down the hill under control. Positioning the body in inversion using the other foot, and roll, or eversion using the other foot, and rolling down the hill, controlling the descent. And you can see the body actually goes into an ankle sprain type position, however the control into that position is the important part. Plantar flexion with what we termed an inversion bias, simply going up on your tippy toe up the hill. The slope of the tilt board makes gravity pull you into an inversion position, so there's an added strength component that keeps the body from rolling into the inversion sprain position. And now we have the foot abduction on a tilt board, which is simply positioning the whole body over the foot in a position that would make you more prone to rolling your ankle, which is simply the twist motion. Ankle sprains occur a lot in cutting. So you have the twist of the body over the ankle, which requires a lot of strength at the ankle to control, again, the descent down the tilt board. So we move on now to knee pain, specifically anterior knee pain. Modifiable risk factors for anterior knee pain: calf tightness, hamstring tightness, iliotibial band tightness, quadricep tightness. Flexibility is a big factor here. Hamstring, quadriceps, hip weakness. Finally, the VMOVL reflex timing, simply the lateral part of your thigh and the medial part of your thigh have to contract at a certain sequence to protect your knee from injury. And that's something that can be assessed, however it's difficult to treat, so there's no real specific exercise we give here to actually improve that. That's something clinically you use things like electrical stimulation and some very specific single-legged activities that are somewhat risky if the person is injured. Valgus knee motion. Specifically, valgus knee motion is the knee diving inward. Okay? Standing, bending the knee, you can observe an athlete's knee diving inward over the inside of the foot. That's what valgus knee motion is. And we'll show you a video of that just so you can understand exactly, you can see it, you cannot miss it in those that have severe valgus knee motion. What are some of the risk factors for valgus knee motion? Ankle dorsiflexion range of motion. If it's limited, your body compensates by rolling your knee inward, and that will perpetuate the valgus knee motion. Hip abduction, extension, and external rotation strength. It should say weakness because it is the weakness of these muscles that would actually cause you to be more prone to the valgus motion. Abduction, extension, external rotation, simply the glutes. The glute maximus, the big muscle in your buttocks. And then flat foot deformity. Flat footedness simply drops the kinetic chain inward, causing the valgus motion to occur at the knee. Non-modifiable risk factors: generalized ligamentous laxity, patellar compression or tilting, the Q angle, which is the valgus knee motion that you will see. It's actually in just standing posture. You'll see it a lot in the younger females, simply because females have different pelvic structure due to the birthing canal. They have a greater valgus angle. Patellar compression or tilting would be also caused by that Q angle. Simply the patella sits in a groove and it rubs on one side too much without equal distribution. You will have cartilage wearing or pain in the area that it was rubbing. So we move on to prevention. We work to lengthen the quadriceps, hamstrings, and calf. Strengthen the quadricep, hamstrings, calf, and glutes. And we'll show you some examples of that here. So here we have the valgus knee motion that we were just talking about. If you observe the knee a single-legged squat, bending and diving inward at the knee. There's the valgus component right there. And in severe cases, it's unmistakable. So that valgus motion puts you in a position where you're more prone to the catastrophic injuries like ACL, MCL, meniscus tears. Also, the knee diving in will cause the patella to track improperly. That is a corrected squat, where a conscious thought is actually taking the knee and putting it out towards the outer foot. Next, we have a stretch here for the ankle. If you notice here, this is the stretch in gastroc, simple calf stretch. Nothing new here. So back leg is straight, heel is down in the back, and there is the ankle dorsiflexion occurring at the ankle. This is just one of the calf muscles that, if tight, could cause a loss of ankle dorsiflexion. Moving on to the soleus. Soleus is a deeper muscle to the calf, the one less noticed. In fact, most people can't even see it. Bending the back knee simply isolates the soleus into a stretch. So you see the back knee is bent, heel is on the ground, dorsiflexion is occurring, and you feel a stretch around the lower part of the calf, the soleus. Moving on, we have the hip hinging here. You notice it's a single leg deadlift where the action is all the hip, utilizing the glute hamstring complex, and the calf would be working here to stabilize the single leg stance. You'll notice that the action occurs all at the hip, minimal action at the knee and ankle, and just bending as far as your hamstring will let you. Usually the end point or the limiting factor of the motion is the hamstring simply tightening up. You'll feel a stretch. Move on now, we have an anterior lean at the ankle, or you're just simply leaning forward at the ankle, causing your ankle to contract to keep you from falling forward. Okay? So you see here the body leans forward, the foot claws the ground, and the ankle contracts to keep you from falling forward. This occurs whenever you land. Running, walking, or landing from a jump, this contraction is necessary to help absorb the shock. If the shock is absorbed here, it just goes right up the chain to the knee. Moving on here, we have the hinge action at the hip, added an arm reach to actually get the glutes to contract a little more effectively. We're trying to get the glutes, which are again the abductors, external rotators, and extenders of the hip. If we go here, you'll see that there's the hinging motion, but then the opposite arm reaching across the body results in a glute contraction. The limiting factor here is you feel a stretch actually in the glute of the standing leg as you're lengthening it to its max. Here's just an easy hip flexor stretch. There's a multitude of different ways to do it. This is just one leg to be stretched on the ground, abdominals remain tight, drawing the hip forward until a stretch is felt down the front of the thigh. And that is a rather simple way of doing it. Again, there's many other ways to do it, all of which would be correct. Stretching the TFL, which is also, we would call it IT band. The iliotibial band runs down the lateral thigh. You hear a lot of people complaining about IT band tightness. The TFL could usually be the culprit. It's the muscle on the top of the iliotibial band, right in the lateral thigh, or lateral hip. We see here, you have the leg to be stretched going back and across, toe pointed slightly outward, sticking the hip out to the right side, looking for a pull on the lateral hip. So again, leg to be stretched is back, heel on the ground, toe pointed slightly outward, sticking the hip out towards the leg to be stretched. And moving along. Further prevention for knee injury, namely some of the more severe injuries like the ACL tears, MCL tears, meniscus tears, is the neuromuscular control. Proprioception, which is like a more complicated way of saying muscle memory. How does your body coordinate large joint, full body movements, which is basically all sports is. For neuromuscular control, they utilize jump training, namely landing from a jump, balance and proprioception, meaning the same thing for that purpose, and plyometrics, which is essentially landing from a jump and exploding out of the jump. Proposed sequence here, the research put out, was dynamic warm-up and stretching, followed by the power multi-joint moves, then isolating the stabilizers. Okay? Now, I can say that that makes sense simply because you need to warm up. Secondly, you don't want to fatigue the stabilizers by isolation exercise prior to developing those powerful moves, as that might actually theoretically make you more prone to an injury. So if we move to the videos here, we have a couple of examples of the neuromuscular control training, squat training. Here we have our model doing a squat. You'll notice the bend of the knees and the knees moving outward over the lateral toes as opposed to the inner foot with the valgus knee motion. It takes conscious control to make those go outward, so it actually takes some thought, some cueing from a coach. Using the arms between the legs to actually further cue the person to move the knees outward as they bend downward. And you'll notice there was a minimal, if you don't mind playing that again, you notice there's a minimal translation of the knee forward when we get to the lateral view. The knee maintaining its position above the ankle as opposed to the toes just takes some of the stress from the knee as well, keeping it back onto the hip and the glutes. Moving on, we have landing from a jump, and exactly how you pause it on the land. You'll notice just jumping off a step and landing, knees going out over the outer foot as opposed to the inner foot. Okay, it takes conscious thought and cueing again from a coach or someone observing. Hands the same position again for further cueing to keep the knees out over the outer toes. It's landing from a jump combined with that valgus knee motion, and God forbid if someone rolling into you, that would cause some of the more severe knee injuries. So that's just an example. You see a few more in real time here, just knees outward, a little fast. However, conscious control takes thought, takes verbal cueing to actually get those knees to go out over the outer toes. Moving on to low leg, ankle, and foot. The lower leg, ankle, foot, that's anything below the knee that we're talking about now. Modifiable risk factors, things we can change. Posterior tibialis weakness. The posterior tibialis is a plantar flexor, or it gets you up on your heel, or on your toes, excuse me, toe raiser, and an inverter, which you can observe in the video coming up here. It resists loading in the pronation phase of gait, simply it absorbs shock, and it prevents the flattening of the foot, which would then further prevent the valgus knee motion. Toe flexor weakness, a big risk factor for plantar fasciitis, or just generally pain in the heel. Running on hard surfaces, constant impact on the heel would cause some possible bruising or at least repetitive trauma if the surface was too hard or there wasn't an accommodating footwear. Non-modifiable risk factors include foot deformity. So, how would we prevent these things? Strengthening dorsiflexors, inverters, which you already saw some of the dorsiflexor stuff, and plantar flexors as well. Stretching the heel cord, you already saw the gastroc soleus stretch in there, which are two ways to stretch the heel cord. Again, there's other techniques as well. Environment modification, footwear is also big. Environment modification meaning just changing the running surface. There's rubberized track, there's grass track, there's pavement. Constantly running on hard surface, again, could result in repetitive use traumas. And footwear is something we're not really commenting on here, but there's a great deal of options out there for footwear, and you speak with someone who can appropriately size you for the footwear, and someone who can actually prescribe a good shoe for you based upon their knowledge of footwear. That would certainly help with any of the foot deformities, the flat-footed deformities. Right. And of course there is orthotic prescription as well, which once again is a little outside of our scope here. So moving on, we have a couple videos here. You'll notice the full and limited plantar flexion here. This is the plantar flexion inversion of the posterior tibialis that we just mentioned. You'll notice at the top there's a little outward motion of the ankles. That's inversion. Okay? That's an important component that indicates that the posterior tibialis is actually doing its job. All right? And then coming up, you'll notice that there's a few that we're going to do here that have none of that inversion. Okay? That is just an indicator that the posterior tibialis isn't quite doing its job, and it probably wouldn't be as effective in absorbing the shock. So you're noticing that there's less of the inversion component. This is something you want to observe with both feet and one foot. Doing it on one foot would be a greater resistance, as where in sports you're landing on one foot most of the time. So here we have contracting the inverters, which is one of the movements of the posterior tibialis. Okay. You'll notice here, simply position yourself rolled uphill using the other foot for assistance, then rolling down the hill slowly, controlling your body weight. That is the ankle inverters contracting eccentrically, like we had mentioned. There's a close-up there. You just notice you rolling down the hill on one foot, assisting yourself with the other foot on the way up. Next, plantar flexors and inverters. Plantar flexors being the muscles that get you up on your tippy toe. Here we have you're assisting yourself to get up on the tippy toe of the right foot in this case, lowering yourself down the hill. Assistance on the way up, single-legged lowering down the slope of the tilt board. That's eccentric plantar flexors inverters, which would be the posterior tibialis. Next up, Toe flexor strengthening. One of the risk factors for plantar fasciitis. You'll notice here we use a TheraBand, wrapping it under the foot, up and over the lateral 4 toes, not the big toe. That's an entirely different muscle group. The 4 toes are then compressing the band into the ground, flexing the toes, using the resistance of the band. Notice how, again, the big toe's not involved. Okay, now, so what we'll have is Zach step in here, and he'll do shoulder and back pain for you guys.
Now on to back pain. Although this type of injury is not as prevalent as the hamstring injury, back pain is really one of the most common injuries and one of the most common conditions that we see in the field of physical therapy. These types of injuries can really range from herniated discs to muscular strains, from spinal fractures to radiculopathies. In terms of track and field, there are a variety of scenarios where the athletes can be injured, whether that be in the weight room or whether that be landing incorrectly from a jump. Yet there are ways to prevent these back injuries. Here are some of the modifiable risk factors that you can alter to decrease the occurrence of back injuries. The first being activity level. Athletes who are both sedentary and extremely active are both at risk. Sedentary athletes are generally out of shape and their bodies are not at the level they need to be in order to meet the demands of the sport, which really does put them at an increased risk for their low exercise level and tolerance. On the opposite end of the spectrum, extremely active athletes are at risk as well. They tend to overtrain and does not give the body a chance to rest and recover, as Jeremy touched upon before. Next is the athlete's weight. For those athletes who have higher body weights, they are also at an increased risk for back injuries. For these athletes, their bodies and joints have additional weight which they have to compensate for. A lot of the stress is placed on the lower back and the lower lumbar spine. On to operating heavy equipment. This is directed more for the throwing athletes. The throwers have to generate maximal force in a very short amount of time. Many techniques require excessive amount of torque throughout the body and really places the spine at risk, whether that be the javelin, the discus, shot put, and if you also have the hammer throw. A lot of that requires a lot of torque through the spine, and it's very strenuous on the lower back. There still is conflicting evidence between strength and flexibility. Studies are still somewhat undecided as to favoring strength over flexibility or vice versa. Some studies feel that focusing more on strength will leave the body rigid and really not allow for too much motion through the joints. Yet while increasing flexibility may lead to decreased stability throughout the joints and allow for excessive motion while throwing. There's also a psychosocial aspect to this. Fear and avoidance of an activity due to fear of provoking pain will cause them to become inactive for most athletes. They will not want to participate in any type of activity or even especially a high intensity exercise such as track and field for fear of really provoking that pain that they have grown accustomed to. This could ultimately lead to depression and distress. Now on to some of the non-modifiable risk factors. The first being age. Unfortunately, as we all get older, our risk for developing back pain and back injury increases. This is due to the common wear and tear over the years, or it can be due to a multitude of disc conditions which you may develop over the years as well. There really are many factors which play into back pain and age. The next is gender. Through our research and through the studies that we came across, females do tend to have a greater incidence of lower back pain for various reasons, some of which we'll be discussing later on in the presentation. Now, in terms of prevention, the first preventive measure is education. This aspect of prevention is very powerful. For those with back injuries who are not informed about their condition and about their injury, can start to display some of that avoidant behavior. This simply means that they will start to avoid activities and any type of motion that will really be provoking that pain. The fear or avoidance is a predictive factor in long-term prognosis and how that athlete recovers. If someone believes that their back pain is a permanent condition and will be affecting them for the rest of their life, they'll most likely be adopting behaviors that go along with that way of thinking. That's why educating them is so important, and letting them know that they have a favorable prognosis is also important. Another big point of this is returning to activity even in the presence of pain. We're not saying that you should have your athletes go and exercise if they're in excruciating pain or if their symptoms tend to get worse with certain motions. But minor pain is acceptable. As long as it's really not provoking the symptoms or making them worse, it's okay for them to start really getting back into their sport or their event. A steady progression in terms of the difficulty level of those exercises should be implemented in order for them to return fully to their respective event as well. The next is posture and body mechanics. Making sure your athletes are using proper body mechanics and posture during each of their events is crucial, not only to their success, but also to their health as well. You must really take note of them performing the motions to make sure that they're not compensating using any other type of musculature or really any other movement pattern which may put them at risk for an injury. On to strengthening and flexibility. As previously mentioned, focusing solely on just one of these could lead to injury. A good training regimen, a good way to go about exercising is have a good combination of both. Now on to some of the videos in terms of preventing some of the back pain. The first being hip hinging. Just as it says, you want to focus on hinging at the hips. Stick the buttocks out backwards, putting the weight onto the heels with the knees slightly bent, while the upper body comes forward. No real movement should be coming from the spine or through the knees. Power for bending, lifting, jumping really should originate from the glutes and the musculature, and not so much the spine or any type of movement at the spine. The next is posterior pelvic tilt. As a cue, put your finger on your belly button, and now try to bring your belly button back down to the surface of the table. You're going to feel your pelvis tilting as you contract your abdominals. These exercises really help with strengthening musculature of the lower back and pelvis, and also work on improving range of motion through these joints as well. Now onto the posterior pelvic tilt with a little bit of hip flexion. To make the previous exercise a little bit more challenging, once the initial steps of the posterior pelvic tilt are completed, perform the same steps as in the previous exercise, but now once the abdominals are contracted and when the pelvis is tilted, you're going to flex both hips and bring your knees up towards your chest, all while keeping that posterior pelvic tilt during the entire range of motion. As you can see, obtain the posterior pelvic tilt and then bringing the hips up. Really focusing on the form for this exercise. Next is the prone back extension. Focus on getting a contraction of the lower back and the mid-back musculature. Most strengthening, especially core strengthening, involves flexion exercises. So a lot of crunches, a lot of sit-ups. Prone back extensions really target the posterior musculature to add symmetry to an athlete's training routine. As you can see here, not a lot of movement at the neck. Everything is really coming from the low back, keeping the arms by the side, not letting the athletes kind of rotate to one side. You could also notice some muscular imbalances if they do deviate to one side or the other. Now, moving on to shoulder pain. This type of injury and type of pain is really more oriented for the throwers and some of the other athletes such as pole vaulters. The modifiable risk factors have to do with scapular dyskinesis, which is simply abnormal movement of the shoulder blade. This could be due to restrictions such as tight musculature or joint dysfunction, or it could be due to muscular weakness and the inability of certain muscles to produce effective movements, especially during the throwing motions. The tight pectorals or latissimus dorsi, otherwise known as the lats, could limit the movement of the scapula during any type of shoulder motion, especially anything overhead. Weak or restricted internal rotation, along with limited shoulder elevation, could cause both shoulder pain and muscular compensations due to altered body mechanics during a throw. On to non-modifiable risk factors, the first being age. Once again, with age comes wear and tear to the shoulder joint. As we age, cumulative damage of improper movement patterns over the years can stress and lead to injuries within the shoulder joint itself. Also, the decreased muscle strength allows for decreased stability within the shoulder joint. When the shoulder joint is stressed or used, especially during powerful throwing motions, there needs to be a certain amount of stability through that joint. If the muscles are weak, then they leave the joint vulnerable to injury. This can also cause a little bit of stress to the compensating musculature. If you're using a different body mechanics or a different movement pattern, you're not going to be really stressing the motions of the shoulder that need to be stressed, and thus some of the other muscles surrounding the joint will be likely to be injured. It's just another reason why exercise is important for athletes and both non-athletes as we age. Now on to diabetes and thyroid conditions. Although much different than regular shoulder pain, a diabetic or thyroid condition often starts with difficulty moving the shoulder. You can have dull, aching pain with any type of motion. Really, picking a bag up off the floor, you just start to have kind of a dull pain within the shoulder. Those with these conditions are at increased risk for developing frozen shoulder, or otherwise known as adhesive capsulitis. So that dull pain eventually leads to not moving the shoulder, and the joint kind of freezes up, causing that frozen shoulder, for that athlete. On to prevention. The first being strengthening. As previously discussed, a lack of strength really does leave the athlete vulnerable to injury. Due to the repeated stress placed on the shoulder and really the surrounding musculature from repeated forceful overhead motion. And due to that, the rotator cuff plays an enormous role in any type of throwing motion, as you all know. The rotator cuff is actually a group of 4 muscles, those being the infraspinatus, supraspinatus, subscapularis, and teres minor. In terms of the parascapular musculature, that's simply just the muscles surrounding the scapula or the shoulder blade. All of which, the rotator cuff and the parascapular musculature are involved during any type of throwing motion, or shoulder motion for that matter. There are some specific exercises which we'll be showing to improve the strength of all these muscles as well. Now on to stretching. Tight muscles may affect or limit the ability of an athlete to perform any type of required shoulder motion, whether that be the pole vault, getting that pole up, javelin, getting that shoulder up and back, and the first of which may be affecting that are tight pectorals. The large muscle group, pectorals, which we're looking at in the front, and the pecs, may cause a flexed, rounded shoulder posture, which ultimately limits the amount of shoulder flexion and shoulder motion during any type of overhead activity. Next is the latissimus dorsi, or otherwise known as the lats. Tight lats will restrict the elevation and contribute to postural dysfunction. With restricted elevation, athletes may turn to excessive spinal extension, so leaning back more so that they can get that shoulder up, or even just rotation in order to achieve that elevation within the shoulder joint. Lastly is the posterior capsule, which affects external rotation of the shoulder, so this motion. Okay. External rotation is a crucial movement of the shoulder for any throwing athlete, especially when the arm is overhead. Whether that be the javelin, whether that be even just the discus coming across, the external rotation is a crucial movement of the shoulder for any type of throwing athlete. If an athlete does not possess full external rotation, so being able to bring that arm all the way back when throwing forcefully, then they're going to compensate by placing additional stress on the surrounding musculature and the rotator cuff and the shoulder joint itself. A balance between strength and flexibility must be achieved in order to maximize performance and also to minimize the risk of injury for your athletes. Moving on to the videos. The first being a protraction push-up. You want to assume a regular push-up position at the top of the range of motion, just pushing your mid-back up towards the ceiling, really trying to almost push through that surface. You get really just at the top, and then that little bit of extra movement at the top range of motion. There should be no dipping at the hips, really, and this is more for a beginner level exercise. It's modified, so we're on a table, so not as much force, is being distributed through the shoulder and through the musculature. If you want to make it tougher, you can have them, eventually start here and eventually working their way down towards the floor, doing a normal push-up. Next is scapular retraction and prone. Lying on your stomach with a little bend in the elbows and the head supported. Focus on bringing the shoulder blades together and getting a good contraction between the musculature between the shoulder blades. Really also focusing, not bending that arm, besides that little bit of bend in the elbow. As you can see, the shoulder blades coming back and together, just really opening up the chest, bringing everything backwards. The next is scapular rotation prone. Once again, lying on your stomach with the head supported, keeping the arms straight. All the motion is coming from the shoulder joint and the scapula, your shoulder blade. There should be no movement of the torso during this motion, so really just focusing on the athlete performing this motion Really not having the torque at the torso or rotate at the torso. All the motion coming straight from the shoulder. And also keeping that arm straight. If you bend at the elbow, you're able to kind of compensate and really not stress the musculature that you're looking to stress. Focusing on form with a lot of these exercises is more important than repetitions, more so than weight. Good form is really the basis that you want to start your training regimen out on. The next are scapular depression dips. Staying with the arm supporting the majority of the body weight, you want to keep the arm straight throughout the movement. Any bend in the elbows is really going to transfer some of that stress to the triceps when you really want to focus on the lats and the scapula. As you can see, there isn't too much motion that you're going to be getting during this exercise. An athlete should not be able to dip all the way back down, bending the elbows. It's really just a minor movement, almost shrugging the shoulders and coming back down. Now, onto the rotator cuff. First, we have the extension diagonals. Okay. Starting position is with the thumb outwards and externally rotated, so above, with a little bit of bend in the elbow. So you begin the motion, start internally rotating the arm and bring the thumb down, pointing towards your body. A good cue is that you're holstering a sword. So coming up and out, coming back and in. And as you can see, not a lot of bend in that elbow. You don't want the athlete to really internally rotate as they come down, keeping a little bit of bend in that elbow, one straight motion, up and back. Now into the flexion diagonal. This is the reverse movement pattern of the previous extension exercise. Having a little bit of bend in the elbow again, pretend that you're taking the sword out now. The thumb inwards to thumb up and outwards. Once again, no motion be coming from the torso, all the motion should be coming from the shoulder. As you can see, really just one movement pattern or one diagonal motion, no torquing, no rotation at the torso, all motion coming from the shoulder with a slight bend in the elbow. And thumb back up and outwards. It's the easiest thing. One of the big things is thumb down towards your hip, back up and outwards. Now it's neutral internal rotation. Keeping the elbow flexed 90 degrees while performing this motion, the towel is really just there as a cue to keep that elbow in instead of letting it flare out. And as you can see here, coming in towards the stomach, coming out to about 90 degrees. Not letting the arm flare out, not letting the elbow flare out as well. Moving on to the external rotation. This direction will be a little bit tougher than the previous exercise. Note that the elbow maintains a positioning throughout the exercise, really not letting that elbow flare out as you bring that hand out to the side. There shouldn't be too much motion, really just focusing on isolating certain external rotators within the shoulder. Good. Now, in terms of abducted internal rotation, to make the previous internal rotation exercise a little bit tougher, a little bit more difficult, bring the shoulder to 90 degrees while maintaining 90 degrees of elbow flexion, so this motion. Really focus on not letting the elbow or arm dip down. So, as our model Jeremy comes forward, really coming forward to that 90 degrees and back up. Controlled motion throughout, not letting it whip back, not letting it whip down. Really focusing on body mechanics once again. Now moving on to the abducted external rotation. Once again, this is the opposing motion of the internal rotation. The arm does not dip down while bringing the hand up and backwards. So as you perform this, coming down to 90, back up to 90. Controlled motion throughout, not letting that arm whip back down, even back up. Now on to scaption. Holding a light weight in the hand with thumb pointed upwards, the arm should be on a diagonal and brought up to about 90 degrees or eye level. Do not go beyond that point because it just places additional stress on the shoulder joint, so really focusing on the athletes coming up, right about eye level, shoulder level, and then back down that diagonal. Now moving on to the exercise known as the empty can. Holding onto a light weight again, have the thumb pointed down towards the floor in this motion. Bringing the arm up, ending the motion a little bit less than 90 degrees. Going beyond that just tends to cause a little bit of impingement and cause a little bit of friction within the shoulder joint. So once again, coming up to about here and back down, a little bit less than shoulder height. And lastly, stretching those internal rotators. This is a good stretch that you can have the athletes do, no equipment necessary. Bring the shoulder to about 90 degrees, lying on your side. Have the elbow flexed to 90 degrees as well. Using your other arm to push downwards on that hand. Do not push down forcefully. It does not take a lot of force to actually get a good stretch using these body mechanics. Stretch should really be felt in the front part of the shoulder. And really just focusing a little bit of stretch, and once you're there, really not forcing it down any further than it needs to go. These are really just a few exercises from the Throwers 10, which was developed by Stephen Ellis and Dr. Kevin Wilk. Also, we have not included some of the more well-known exercises for certain muscle groups, which are also important for preventing shoulder injuries. The upper arm, it's important to strengthen the biceps and the triceps with simple bicep curls, tricep extensions. It's also important to strengthen the wrist flexors and extensors, so, wrist curls, wrist extensions. Even though it may go overlooked at times, exercise for pronation, which is this motion, bringing the palm down towards the floor, and also supination, bringing the palm up, towards the ceiling, are also important. All these exercises really are beneficial for throwing athletes, and any athlete for that matter, if the shoulder is involved for their event. Weight, repetition, sets, frequency, that's really specific to the coach and also the athlete's preference as well. Moving on to the female athlete. Female athletes have 3 times the rate of ACL tears compared to their male counterparts. Also, females have less favorable reported outcomes after the initial repair. Studies have shown that the increased need for additional surgical procedures, such as a revision, is also necessary for most athletes after the initial repair. Female athletes have 2 times the rate of patellofemoral syndrome in their other male counterparts. The cause of pain dysfunction often results of either abnormal forces, such as muscular imbalances surrounding the knee, or it could be due to prolonged, repetitive, compressive or shearing forces, such as running or jumping on the knee as well. The result is thinning and softening, referred to as chondromalacia, which Jeremy touched upon before, which is simply, cartilage under the patella of the knee becomes a little bit soft and inflamed. These 2 types of injuries in which females are at risk for are due to a number of factors, such as increased Q angle, which Jeremy has touched upon previously. The increased Q angle increases the vulnerability of the kneecap or patella to move and really cause other problems within the hip, the pelvis, the knee, and also in the foot. Another possibility as to why females are at increased risk is their menstrual cycle, which contributes to ligamentous laxity. If the ligaments are lax and do not maintain the necessary stability which is required for especially a lot of these high-intensity events, then the athlete is also at an increased risk for injury. Lastly, athletes are also at an increased risk for stress fractures. The 3 main reasons for this are the low body weight, which also correlates along with a low BMI, and also the risk for stress fractures increases with age. A low body weight and a low BMI can be attributed to improper nutrition, where the athlete's not intaking, proper calories, proper vitamins, proper minerals, which the body truly needs in order to maintain sufficient bone strength. Proper diet should be stressed for all athletes and not just female athletes, and that's really, your job as a coach is to educate them as well. As female athletes age, they're also at an increased risk for stress fractures, which may lead down the line to osteoporosis. As we age, the bones lose their tensile strength and can become weak, allowing increased risk for fractures, mainly due to hormonal changes within the body itself. Moving on to considerations for running. The first is one's cadence. That's simply the number of times your feet hit the ground per minute. Our studies and our research have shown that 108 steps per minute allows for optimal running technique. Increasing cadence to 100 steps per minute decreases overall step length. Simply, increasing cadence is more steps, shorter strides. This will ultimately decrease the impact forces due to the decreased heel strike with these shorter steps. The heel strike actually impedes the forward motion of the runner, acting almost as a braking mechanism and really decreasing their time overall. If you think about it, coming forward, you're not really coming forward on good, with good posture on that heel. It's actually slowing you down a little bit. Whereas if you were to tilt and really run with the forefoot, it may just increase your time by propelling you forward. That's one of the proponents really for that forefoot running or toe running, as Jeremy touched upon before. Next is an athlete's step width. Increasing step width decreases IT band tension. The IT band runs from the hips down to the knee. In a wider stance, it does not have as much force and strain placed upon it. Someone running with a narrow stance can put additional stress on the IT band since they're lengthened throughout the run. By increasing the step width by only 5% of the leg length, an athlete can show improvement with their running technique and also their running times. For example, if an athlete's leg was 100 centimeters, they would only need to widen their running stance by 5 centimeters to make an improvement. A good way of doing this, or a technique that you could use, is really going for that muscle memory. An athlete, whether it be 5 years, whether it be 10 years, they've developed their own type of running technique. So you as the coach really have to implement a way to change their muscle memory. An easy way of doing that, instead of running within the 2 track lines, have them running along the track line, really focusing on not letting their feet touch that track line. It's an easy way to really widen their step length and so their step width, excuse me. Another thing, you could put tape down, in a certain foot in between, 5 inches, whatever it may be for that athlete, and just having them run with that stride, focusing really on not letting the feet come beyond that tape. Lastly is the arm swing. An effective arm swing is when the amplitude is matched to the stride. By pumping the arms as much as possible, as fast as possible, as strong as possible, when you have a short stride, you're really just tiring yourself out and really doing more work with less than favorable results. Athletes with a shorter stride should use a shorter arm swing. The balance between upper body and lower body decreases compensation and also decreases energy expenditure for your athletes. Moving on to the discussion. Coaching is key. Through our research, we found that the presence of a coach cut injury incidence in half. You're one of the first lines of defense to preventing injuries, whether it be due to your training methods, your insight into athlete body mechanics, or hopefully just using some of the techniques and stretches and strengthening exercises that you've learned today. Education and observation for early detection. This is taking a proactive approach to making sure strength, flexibility, body mechanics, and all their areas of the athlete's physical abilities are in check even before an injury occurs. By finding any type of limitation or impairment before an injury will allow for correction and prevention for an injury later on that season. Checking for risk factors, as Jeremy touched upon before as well. This has to do with some of the more serious injuries and conditions such as heart problems or congenital abnormalities that may be present within an athlete's family or family history. Knowing that can allow you as a coach to set up training limitations for that athlete and also be prepared if something was to happen at a meet or a practice. Also, there is no off-season. I repeat, there is no off-season for your athletes. Our research has shown that year-round fitness decreased incidence of injury. As previously mentioned, sedentary and extremely active athletes are at risk for injury. This does not mean that a sprinter will be sprinting 365 days out of the year, and this does not mean that a javelin thrower will be throwing 50 times a day every single day for that year. On the other hand, an athlete should not be active for only a few months out of that year and then for the rest of the time be sitting at home doing nothing. Proper season and off-season workout plan should be implemented, which incorporates really cross-training, so not doing the same activity over and over and over, proper strength training, and also proper flexibility training as well. This year-round exercise program will help to decrease the amount of injuries for your athletes and ultimately help build better athletes for each of your respective teams. Overall, moving on, just really want to thank you for having us here today. Here are listed some important and informative websites along with our contact information. As Jeremy noted before, these exercises and videos will be available to you if you would like that. You can contact us through our email and we'd be happy to send those over to you. And we're also really trying to get those up online so that you can have access anytime that you would like them. Thank you very much for your time, and we'll be taking some questions.